Bismillahirrahmanirrahim. So, dear student, today we are going to talk about different terms related with heart failure. What are the different terms that are related with heart failures? First of all, we have high output heart failure. In high output heart failure, what actually happen? In this case, what actually happen is that heart function is more than normal. Heart is normal, it is not pathological, but the demand of the body is too much, and this result in heart failure. So, heart function is more than normal. It means that myocardium and other factors are working normally, but demand of the body is too much increase that heart failure occur because heart cannot fulfill these needs of the body. So here we will discuss this occur in the following diseases. What are the different diseases in which high output heart failure occur? What are the different diseases in which body demand is increased too much even if function or activity of the heart is normal? So number one is severe anemia. In case of severe anemia, hemoglobin level is decreased in the blood. When hemoglobin level is decreased in the blood, this hemoglobin will carry little amount of oxygen to tissues, so more oxygen will be required to the tissues, but heart cannot fulfill this because heart cannot function even so much strongly to fulfill this need, because hemoglobin level is too much decreased that even if heart function slightly or more than normal, still heart is unable to fulfill this need, so the result is heart failure. Second thing is pregnancy. In pregnancy also body need of oxygen is increased so much that heart cannot fulfill this need, and this especially occur in case when there are two children. When there are two children, the oxygen demand is increased too much or more than two children. So in case of pregnancy, we have high output cardiac failure. Third thing is Paget disorder of bone. Paget disorder of bone. What actually happen in this disorder? In this disorder, bone metabolism is increased too much, and this need more oxygen and more blood. So when Paget disorder of bone occur, then oxygen demand is increased, and this increased demand result in heart failure because heart is unable in this case to fulfill the needs of the body. Another disease is arteriovenous fistulas. In arteriovenous fistulas, what actually happen? In this case, there are no capillaries present between arteries and vein. Normally, we know that between vein and arteries, a connection or network of capillaries is present. But in case of arteriovenous fistulas, there is no capillary network between artery and vein. This is for example artery. These are the cell or tissues, and this is vein. This is the point where normally capillaries should be present, but in case of arteriovenous fistulas, no capillaries are present. So what actually happen? As we know that in capillaries, diffusion occur, but in arteries and vein, no diffusion or very little diffusion occur. So when there is no diffusion of blood, oxygen, no diffusion of oxygen and other nutrients, so less amount of oxygen will reach the tissues, and we will say that cardiac function is normal, but still body demands of oxygen is not fulfilled and heart failure will occur. So arteriovenous fistulas also cause heart failure. And another factor is beriberi. In what actually happen in beriberi? In beriberi, thiamine concentration is decreased in the blood or in the body. So glucose may partial breakdown occur. Glucose do not break completely, but partially breakdown of glucose occur. Another factor, lactic acid is produced and peripheral blood vessel dilate. This dilated blood vessel these dilated blood vessel result in quick and rapid flow of blood from arterial side to the venous side. As now we know that when during beriberi blood vessel dilatation occur, then this will result in repeat flow of blood from arterial side to the venous side. Now when blood flow is repeat, the time for diffusion of oxygen will be small or less, so less diffusion will occur, and we will say that body demand of tissue oxygen is not fulfilled and heart failure will occur. So this was high output cardiac failure. Now we are going to talk about low output cardiac failure, LOCF. In this case, the function of the heart is not normal and it is decreased, heart is damaged, but the demand of the body is normal. So body demand is normal, and but function of the heart is not normal and it is failing to perform its function. So low output cardiac failure is opposite to that of high output cardiac failure. What are the different diseases? What are the different problem in which low output cardiac failure occur? Let's discuss. First of all, myocardial contractility failure, MCF. Myocardium, in this case, when myocardium of the heart, for example, this is the myocardium of the heart muscular layer, when this is unable to contract properly, it will be unable to pump the blood into systemic and pulmonary circulation, and thus less amount of oxygen will be received by tissues, and we will say that heart failure is occurring. So myocardial contractility failure result in failure of the heart. Second thing is or increase preload. When preload increase too much, this result in low output cardiac failure. Now we discussed normally before that when blood is coming into the ventricle and this increase preload in the ventricle, then output will be increased. Normally with a small amount of increase in the preload result in increased output of the heart. But listen to me, when the preload is increased too much more than normal, then cardiac output is decreased. Why? Because when the blood is coming too much into the ventricle, it it relaxes, and these cardiac muscle and cardiac myocytes increase in length so much that its elastic limit is reached. So when the preload increase too much and so much that cardiac myocytes elastic limit is reached, then cardiac myocyte will be unable to contract properly, and thus cardiac output will decrease, and this will result in a less amount of blood pumping into the systemic and pulmonary circulation, and thus demand of the tissue to thus tissue will receive less amount of oxygen. In this case, different uh, factors will result, which is increased pre-overload, ventricular overload, volume overload, and ventricular hypertrophy. What is meant by ventricular hypertrophy? When the mass of myocardium of the heart is increased and its contraction ability is decreased, this is called as ventricular hypertrophy. Pressure overload and volume overload also occur in this case. Let's discuss what is meant by pressure overload and volume overload. So pressure overload is increase in the pressure of the left ventricle or right ventricle, but here we are going to discuss left ventricle. So when the left ventricular pressure or ventricular pressure is increased, we say that this is a pressure overload. So cardiac myocytes thicken only. In this case, cardiac myocyte only thicken in length but not in in diameter but not in length. This is cardiac myocyte. Its thickness is increasing as I have shown, but it is remember to note that not increase in the length will occur. No increase will occur in the length of the cardiac myocytes, and result will be pressure increase in the left ventricle. So in pressure overload, only pressure is increased and in thickness of the cardiac myocyte is increased. Here I have written a formula: pressure is equal to tension divided by radius. As when preload increases, tension in the ventricular muscle will be increased because of a large amount of blood, so tension will increase. As a result, pressure will be increased and pressure overload will occur. Another thing that will occur in ventricle as a result of increase or preload is volume overload. In volume overload, two things will occur. In pressure overload, we discussed that only thickness of the cardiac myocyte will be uh, increase, but in this case thickness as well as the length of the cardiac myocyte will be increased and volume will be increased in this case. So this is pressure volume load. In this case what happen, volume increases and two types of changes occur in cardiac myocyte: increase in the thickness as well as increase in the length of the cardiac myocyte. Now another factor that result in increased preload is tricuspid regurgitation. In tricuspid regurgitation, what actually happen? Problem occur in the wall that is present between left atrium and left ventricle. This is tricuspid valve. So in this case, large amount of blood come into the right ventricle during ventricular diastole, and thus preload occur in the right ventricle. Pulmonary regurgitation also result in increased preload in case in a right ventricle. Backflow of blood occur from pulmonary artery into the right ventricle during right ventricular diastole. Aortic regurgitation also cause left ventricular preload. Backflow of blood occur from aorta into the left ventricle, and this result in increased preload in the left ventricle. So these were different factors that are causing increased preload. We will discuss next in next lecture, inshallah.